control of the outbreak. Vice Premier Sun Chunlan also went to Wuhan to check on the ground and made plans and also inspect our work. This demonstrates that the CPC Central Committee with Comrade Xi Jinping at its core has attached great importance to the outbreak and also show their care to Wuhan. This also gives us every reason to believe that we can win this battle, and we are confident in this regard. Since the outbreak of the pneumonia, people in China and also the military, people across all walks of life also show their interest and also their focus on the development of the disease. People in China and also the people's military army also keen to know the latest information about the disease, and they also put their life in danger, came to Wuhan at the front line to safeguard people's safety and health. Since the outbreak of the pneumonia, under the leadership of CPC Central Committee, the Hubei Provincial Party Committee and the Hubei government always prioritize our work to combat the battle, and our work can be summarized in the following areas. First, we will do all out effort to save the patient. First, we confirm the Jintan Hospital as the designated hospital to admit the infected patients. With increasing number of infected patients, and we also add more available beds. The National Health Commission also organized a group of experts across China to Wuhan to aid Wuhan, and also our own medical staffs here in Wuhan to work out the plans. And we have taken active therapeutic measures to cure our patients. Second, and we work vigorously to curb the spread of pneumonia. This is a novel coronavirus. How to minimize the spread of the pneumonia is always top our agenda. In order to do a better job in prevention and control of the virus, Wuhan has taken the measures step by step based on the requirement based on the CPC Central Committee, and we make sure that we do a good job control the virus inside Hubei Province and also not export the virus outside. So that's why we suspended our transportation in terms of the flights, trains, coaches, expressways, and waterways inside the province, and we take measures on subways, taxis, buses, and private vehicles. Why are we doing this? Because this is an infectious disease with a mobilization of the population that may cause a wider spreading of the disease. This is the reason why we take measures on the transportation media. On top of that, we also launched the emergency response on public health, and we also conducted a layered pre-examinatory triage. So if our people first found they had fever or not feel good, they first need to go to the community-based clinic. If just see a normal influenza, so they go back home and take prescription, and if it's high fever, then they will send to the fever clinic. So after they receive the treatment in the fever clinic, if it's necessary, they will be kept at the fever clinic. If not necessary, they will be isolated at the community. By taking different measures, the aim is to curb the spreading of the pneumonia virus. And we control our transportation going outside and also taking strict measures on the internal transportation and how we operate the city in a normal order. With the support of the CPC Central Committee and also the help from our neighboring provinces, the supplies, the daily necessities, food, meat, vegetables, fruits are insufficient quantity. If our people need to go outside, we talk about the sharing back, like Mobac and other transportation media also available. If our people has the requirement to go to the clinic or go to the hospital or have other specific reasons, then we have around 600 hauling cars. So 3 cars available for each community for emergency cases.
当然，我们这个工作当中，还有很多前面都做过一些报道和披露的，包括我们要重视医护人员的防护。
That already released to you in the previous presser, and we did a good job to protect our medics.
还有就是要把我们各级党组织、社区的力量
And also we would like to mobilize and also let the party committee at different levels to play a bigger role in order to forge a system to serve our people and also let our people
党的存在、政府的存在。
to feel the help in place, and also the party committee and the party members always there to back our people. This is a general picture of our work. Now I would like to give the floor to Deputy Governor of Wuhan. As of the midnight of January 26, the confirmed case is 1,423, 221 in critical condition, 69 in severe condition, 76 death case, 44 discharged from the hospitals. For close contacts, number is 10,394, 1,291 already removed from observation. Right now we have 9,000 more people under observation. And for our department, we conduct the following works. First, we work vigorously to save the patient, and we have a list of designated hospitals to admit the infected patients, and based on the guidance, and we follow the 4 centralization in terms of the case, treatment, experts, and resources, and we will do a good job to deal with the suspected cases. And also we focus on the treatment the severe condition, and also use ECMO. We successfully save life of one severe condition patient. And second, we conduct different measures, including inviting third party to speed up the dictation or the identification work. So we first confirmed the 41 hospitals with the top class levels and also with the third parties. And the third, we also work out to make more beds available. And we have around 122 hospitals and medical institutions for patients' admission. And we have around 10,000 beds available. And we, for the first batch, have 7 hospitals available. And we have also encouraged the 24 other hospitals to make more beds available. And also, we learn from the Beijing's experience in Xiaotangshan Hospital, and we also built 2 hospitals and with 2,000 beds available. And fourth, in order to relieve burden on our frontline medics, we allocate and mobilize the medical resources from China, across China, and also the military doctors. As of 18 o'clock local time, around 3,000 doctors conduct work in Hubei Province. Right now, we have 4 medical teams with 300 members on their way to Hubei, Wuhan. Fifth, talking about the cost of the treatment, the patient do not need to worry about this payment. The government will pay the bill, and they will not restrict it by the health insurance policies. We should give the treatment first, and then we will do the settlement. And for the reimbursement, that also will not restrict to the reimbursement ratio according to the cross-region treatment. We implemented the first, second, and third draft formulated by the National Health Commission in terms of the therapeutic plans. And for us, we released our first edition in this regard based on the experience and the cases we have here in Wuhan. And that guidance also help the different hospitals to make a solid job to treat the patients, and the medical institutions at different levels all set the pre-examination triage at the fever clinic, make sure the patient with fever have the place to receive medical treatment. And 7, based on the CDC requirement for all the medics, they will receive the protective support and also give them the training on how to protect themselves and also raise their awareness. We also sent different group of guiding experts, professionals to check the work on how the frontline medics protect themselves.
Well, you're hearing a press conference held by Hubei Province to give more details about the latest efforts made to contain the deadly virus. And officials said efforts are made both in treating parents as well as containing the virus from spreading further. And they say they made progress in treatment as they successfully saved 1 patient who was in critical conditions. And they also said medical expenses will be paid by the local government. Meanwhile, the death toll from the coronavirus stands now at 81, and nearly 3,000 cases have been confirmed globally, the vast majority here in China. And